Welcome to today's webinar presented by supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
Sometimes it's hard to come up with some good anatomic pictures. And so you'll see on the slides 3, 4, and 5, those type of slides, that I put those in there mainly for anatomic purposes and that you can see where we're talking about. But trying to find places that will let you use illustrations providing education and training is sometimes difficult. And so I wanted to give you that URL that you could go to, and they have them for all different body parts. So starting on slide number 9, we're going to talk about the ankles, toes, and feet. And because of the fact that you have 2 feet and 2 ankles and multiple toes, it does get confusing, and you have to make sure that you're in the right anatomic area when you're selecting codes. Such as if you're doing transfers of tendons of toes, you can't go use a 276 series. That's transfer of tendons in the ankle. So you've got to make sure you don't cross over to some of the other surrounding anatomic areas. On slide 10, giving you a little bit of a background regarding the anatomy of the ankle, it is a hinge joint. It's not a ball and socket. And so when you do have some dislocations, you're going to find that your ligaments, tendons, muscles, those around there forming that hinge may end up being ruptured, torn, stretched because of the fact it's not just a ball and socket type situation. You're going to find that the ankle is made up of 3 powerful bones that you usually talk a lot about, the talus, which is the top of the talus. It fits right in there with the tibia and the fibula. On slide 11, you're going to find that you have some flexion that is done with this hinge joint, and that there are some significant ligaments. Your anterior talar fib, your calcaneofibular, and your posterior talofibular ligament. These are all important ones along with that deltoid. So when we get in talking about some of the Bristow procedures, where we're talking about the anterior tibial fib ligament that we're doing reconstructions or repair on, that's what we're talking about. You're also going to find that there's a couple other ones. You've got the Achilles tendon that runs along the back of the ankle and down to the heel bone, the calcaneus. We also have the posterior tibial tendon and the anterior tibial tendon. Then we get into our perineals, and we'll talk about our perineals and how they affect, and in fact that there's 2 different ways to use the codes when it comes to your perineals. It all depends on why you're repairing and what's going on. On the foot anatomy, on slide number 14, it shows you that the foot is under constant stress, and the data shows that about 80% of the problems people will have with their feet, and the number 2, 3 problem related to it is your shoe wear. Activity level is one, occupation, if you're constantly on them, but the other one that's the main one is shoe wear. And it's interesting because every year you'll find that some of the specialty societies such as AAOS will team up with, for years they used to team up with Nordstrom's to try to explain, especially for female footwear, the appropriate shoe size and how you fit a shoe to you so that you wouldn't end up with some of these common foot problems. On slide 15, we break it down and giving you some more information regarding what this foot, the bones are. There's 5 talus bones, and so you'll find that the cuneiforms, there's the first, second, and third. Sometimes talk about the middle one, the lateral. And so you've got a bunch of bones in there that you need to be aware of and where they're at. There's also a term hallux that's used quite a bit. Hallux is just a fancy word to say great toe. On slide 16, you're going to find your foot anatomy. So you've got some of your tendons, your dorsal tendons, and then you've got your plantar tendons. And it goes on and talks about your flexor and your extensors and the names of those. In your toe anatomy, we should have 5 toes on each feet, counting your great toe. And so you also have extensor tendons and flexor tendons in there. And the most common is your claw toe, your hammer toe, your mallet toe, that we'll go in and talk about some of those procedures. Some of the other terminology on slide 18, your Atkins, usually for a bunion deformity, arthroesis, bunionectomy, and then the removal of the exostosis or bone spur.
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.